Hello and welcome to another edition of Feel This Pain. I'm Ken McKim, and tonight we're going to be talking a little bit about rheumatoid arthritis. Now, rheumatoid arthritis, or RA, is when your immune system attacks the lining of the membranes that surround your joints. It's called the synovium. And when that happens, the resulting inflammation thickens the synovium, which can then eventually destroy the cartilage and bone within the joint itself. The tendons and the ligaments that hold the joint together can eventually weaken, and then they can cause the inflamed joints to lose their shape and alignment, which results in, well, what you see in this picture right here. It looks painful, and it is painful. Now, of course, most people are familiar with the typical symptoms of swollen and painful joints in the hands and feet, but there are some other symptoms of RA that you might not expect, and we'll go over those in just 1 minute. Common risk factors for RA include being female, because women are more likely to develop RA. Age is also a factor. Anywhere between the ages of 40 and 60 is when it's most common, and then family history can come into play as well. As far as symptoms you might not expect, locked joints is fun when there's so much swelling of the tendons around the joint that it can't bend. There's also dryness in the eyes that RA can cause, and mouth dryness, which can lead to gum irritation or even infection. Other symptoms you might not expect include lung inflammation, which can lead to scarring and shortness of breath, blood vessel inflammation, which can lead to damage in the nerves and other organs, and your blood itself can be sometimes affected by RA. It can lead to anemia, which is a lower than normal number of healthy red blood cells. Now, as far as treatments go, there are medications that can be prescribed. There are NSAIDs and steroids, and those are fairly common, but there's also a class of meds called disease-modifying anti-rheumatic drugs, or DMARDs. Now, these drugs can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Common DMARDs include things like methotrexate, leflunomide, hydroxychloroquine, and sulfalazine. Side effects may vary, but include such lovely things as liver damage, bone marrow suppression, and severe lung infections. So, always have to be careful, because a lot of these treatments do have side effects, and that goes for so many chronic illnesses, not just rheumatoid arthritis. There's a newer class of DMARDs. They include drugs that you've probably heard of, like Orencia, Humira, Enbrel, and even Remicade, which incidentally is also a fairly popular treatment for people who have Crohn's disease. Now, all of these biologics can target parts of the immune system that trigger joint inflammation and tissue damage. But these type of drugs also increase the risk of infections. They, in effect, can suppress your immune system, which is what protects you from getting sick. So if you're on them, you have to be extremely vigilant when it comes to germs. Physicians will also recommend exercises to help keep your joints flexible, kind of build up the strength there, so they're not as susceptible to malformation. Some procedures would call for what's called a tendon repair, right? They just go in and they repair the tendons around the particular joint that's severely damaged. Some people, their doctors might recommend total joint replacement, where they take out the physical joint and replace it with something that's a combination of metal and polymers. And the recovery time for something like that can vary widely, of course, depending on your age and overall health. And then for people who are not a candidate for total joint replacement, they might recommend something called joint fusion, which is a procedure that can basically realign the joint as an option for pain relief and to help it stay in place. Overall here, the point that I'm trying to make to you is that rheumatoid arthritis is much more than just, swollen joints and some pain in your knuckles and your feet. It's a very serious condition, and if you know someone who has rheumatoid arthritis, I would make sure to extend them every courtesy and as much compassion as you can muster, because this is an extremely painful condition, like so many so-called invisible illnesses are. And Your respect and your compassion and empathy will be much appreciated by those who have to deal with this pain every day of their lives. And that's all the time we have for this week. Thank you so much for joining me. If you have any questions, though, please feel free to send them to me, ken@don'tpunishpain.com. You can also follow me over on Twitter @don'tpunishpain. I will see you again, and until next time, I'm Ken McKim. You take care.